Hey, and welcome back everyone. Today we got a little special treat. So one of the hardest things we can treat is old acne scarring. So with this patient today, we're going to do a combo treatment. It's actually her first time in the practice with me. But what we're going to work on today is how to unpucker the old acne scarring and then give a long-term treatment as well. With this patient, she is of Asian descent, and Asian descent, we always have to be careful in regards to how we treat. One of the first rules of treating the skin is don't do any additional damage. And that's actually one of the first rules you learn in medicine as well. Don't do harm. So with Asian skin types, yes, we can be the lightest of light, but we also have underlying melanin that can be reflected outwardly if we do a damaging laser, if we overdo the treatment, or there's pigmentation involved. So that's always the key thing is, no matter what we do, don't do harm first. And the first step, what I'm doing here is I'm subsizing the area. I've already pre-numbed her, and then in this syringe, I also have a little bit of lidocaine. I'm using a 25 gauge 2-inch cannula to subsize. And what that means is when we develop acne scars or we develop scarring in general, we develop potentially these little bungee cords, these little pieces of scar tissue that pull down on our skin. If you ever touch scar tissue, if you ever touch acne scar, it's very, very tough skin. So what we're trying to do is release those little bands that are pulling down on her tissue. So I've already numbed it, and as I'm subsizing or as I'm driving this cannula underneath her skin, I'm also giving a little bit of lidocaine just to make sure she's comfortable, and also make sure that, for the most part, it's making sure she's comfortable. But what I'm doing is I'm moving the cannula back and forth, and you can see some of those areas. When you see the skin pucker as I'm pushing on the cannula, that's areas that are having the tough skin, the little rubber bands that are pulling down our tissue. I'm trying to break that up. So essentially I'm cutting those bands. Now that we finished the cheek area, that's where most of her acne scarring is, you can see me transition the cannula upwards towards her temples. So now I'm doing the same thing. I'm trying to feel for these little bands that are pulling down on her temple area. And you can see it, I was able to finish pretty quickly. Now for the next step, we decided to go with microneedling, and then towards the end of our treatment plan, we may discuss some lasers. But as I've discussed previously, the first step is make sure we don't do any harm. And with microneedling, you're causing controlled physical damage without the energy base of the lasers. She's done lasers in the past, and what happened was she had a huge flare-up that made her red pretty much her whole life. So with microneedling, you're almost taking away all that potential damage that you can cause with the lasers. One of the differences between microneedling and lasers is, with microneedles, you're taking something physical, needles, and you're actually physically breaking up the acne scarring. With lasers, you're taking laser beams to break up the acne scarring. But lasers is hot, lasers is energy based, which can potentially damage the skin, flare up the skin, and cause hyperpigmentation. And we've said it over and over, the first step to treating the skin is don't do any additional harm. You saw me in the beginning. What I did was I took VAMP, vitamins, amino acids, minerals, and lastly PDRN, the salmon DNA, and I applied it topically. And what I'm doing is I'm driving all that in. So I'm causing the mechanical controlled damage with the microneedles, but with the VAMP, I'm trying to induce skin regrowth, I'm trying to induce repair, and I'm trying to force the body to produce new collagen and repair all those areas that were put in those little all those little micropores or micro channels with the microneedling. So we took the VAMP, increased repair, increased collagen, and we're taking the microneedle and we're trying to physically break up the tethering and physically break up the acne scarring so new tissue can replace it. Now I transition back to the VAMP, and you'll see me go back and forth between the PRF and the VAMP, and I'm just trying to drive in all these nutrients. So I'll microneedle a section, drive in the VAMP. I'll microneedle a section and drive in the PRF. And I'm just gonna go back and forth until we treat the whole face. For the most part, you see that we treated the entire face, and now I'm just applying the PRF, the platelet-rich fibrin. So I'm going back and forth between treating different areas of the face, applying the VAMP, treating different parts of the face, and putting on the PRF. So all these things is really meant for recovery and repair. So I'm breaking up the acne scarring with the microneedling, and then I'm just repairing the skin with all these good growth factors, the vitamins, amino acids, the minerals, and of course the PDRN. And finally, the last step, we just put on this recovery mask. So it's going to help cool down the area, help her recover, and then just moisturize and close up all those channels with nice clean skin.